Now, there's another category of drugs that is used in the treatment of asthma, and this is what is known as the Cromones. Cromones, all right. So Cromones is not a single drug; it's a classification of drugs used in the treatment of asthma. So let's look at the examples of drugs that actually fall under this category of Cromones. So Cromones, mainly there are two examples mainly used for asthma. We have the Cromolyn sodium and the Nedocromil. They're actually older anti-allergic drugs used in asthma. So they prevent all those episodes of attacks, right? So they bring about acute relief. So they stabilize mast cells and they reduce all those things that should be released in your system to bring about, reactions. Do you understand? So how these Cromones work is, Cromones block mast cell degranulation and they prevent the release of histamine, leukotrienes and other mediators that will basically trigger allergic reactions to trigger inflammation. Do you understand? So onset, they do not provide immediate bronchodilation, so they are not really used in acute asthma attacks. Do you understand? But you just be using them all along just to prevent, then basically they take time to act very slowly. So if you have been consistent in using them, you understand. So when you're prescribing Cromones to a patient, you have to always emphasize that they must actually stick to the dosings. So this is Nedocromil sodium. So clinical use in asthma is for prophylaxis, prevention. They are not really used when the issues are now on ground. This one, you have been using them all along, so they should prevent the issues from even coming in. They are used in children and young patients in a steroid sparing role, so they may allow reduction in using even other asthma drugs because they help you to now reduce all the issues. So they are typically administered via nebulizers or inhalers.